have you introduced yourself, your credentials, where you work, what you do? How long have you been a nurse practitioner and all that fun stuff?
Okay. All right. So I am Kim Allred, and I went to school. My undergraduate was at Lamar University in Beaumont, Texas, and I got my nursing degree I'm gonna be old now, in 1997. And then I worked for 5 years as a nurse and kind of fell in love with the nursery and the NICU and was encouraged to. It's actually, I'm going to tell my little story about how I became a nurse practitioner because it's a little different. Um, but I started off actually working at St. Mark's Hospital in Utah. That was my first job as a nurse, and I worked on postpartum. And then I thought I wanted to do labor and delivery. I did that for a couple months, and I was like, no, that's not for me. So then I went to the nursery and I kept getting sucked into like this. I was like, okay, I'll do well babies. And then I kept getting sucked into like sicker and sicker and sicker babies. I don't know how I finally because I kept saying I was never going to do that. And then I decided to do a travel assignment back to Texas, which is where I was from. Went to Houston and did a travel assignment. And I was teaching an NRP class, which I don't know, neonatal resuscitation. I don't know if you guys have to, the adult people don't necessarily know what that is. Um, and I was teaching a class with another lady, and she said, well, why don't you be a nurse practitioner? And I literally said, what's a nurse practitioner? Because I'd never worked with any. This was back in 2003 in Houston. And she said, I'm letting 6 people in this program, so why don't you apply? So I did, and that's literally how I kind of just fell into being a nurse practitioner. It was a master's degree from the University of Texas. So neonatal nurse practitioner, it gave me my master's in nursing. And then after that, I interviewed everywhere. And my grandma lived here in Arizona, and she made me promise I would interview here, but I swore I wouldn't move here because I didn't want to do the heat after being in the heat of Houston. So I interviewed all over the place. And then, but you know what? No matter how much I try to talk myself out of it, it was the right thing to do to move here. I joined the group in 2000. I started in May of 2006. So I'm over 17 years of experience. I've technically, well, I worked for the same group and I've worked at the same hospital for about the same amount of time. We just, the dynamics change and all the hospitals change whether they want to actually employ the nurse practitioners or if they want to outsource the nurse practitioners. So throughout that with Phoenix Children's, my first 15 years I was quote unquote outsourced because we were a part of Mednax, which is a nationwide company that covers NICUs. And then in 2020, we actually were hired by Phoenix Children's. So I still work at the same place. My paycheck just comes from a different place. So that is where I am currently. And still, I'm still here.
Oh, that's awesome. I think you told me that story once before, but not in depth. But
Probably.
that would be great to have someone just come at you and be like, hey, you should do this. Okay.
Right? It made it kind of easy because she's like, I'll let you in the program. I'm like, okay. I mean, why would
Fine.
I not? I feel like when things just approach you like that, like you know what, there's a reason those just come around. And
Yeah.
it's been the best decision in my life too. Like I loved bedside nursing. I thought that's where my passion would be. That's where I would always live. And honestly, I wouldn't go back to bedside. I would if I needed to, but honestly, I love being a nurse practitioner.
I think it's definitely something that has to be meant for you to,
Hmm.
for sure. Alrighty. If you can think back to when you first started practicing as an NP, what was one or two of the biggest struggles you faced as transitioning from RN to NP?
I think, and I always talk about this with the students that I get, is that I think it's becoming less and less. It used to be that you had to have several years of nursing experience before you went to nurse practitioner school. I think they're letting them in a little sooner, but you kind of came from a place where you were more of the expert because you had several years of nursing under your belt. And so you had to go from being the expert to now being the novice. And I think that sometimes can be a big transition, and changing your gears. You're always taught in nursing school to never make a diagnosis. And now, like, we make diagnoses. And so that was kind of a big, you kind of would talk yourself around it. And I would have my preceptors, no, just call it respiratory distress. I'm like, but can I do that? So those are probably the biggest two things learning.
Oh, yeah, that scares me.
You got this. You got this.
Consider your scope of practice and regulating bodies within your state. Do you agree with regulations of your licensure designed by your state? And are there any changes you would make to the credentialing and clinical privileges in your place of practice?
Ooh, I like this question. So, our governing bodies, and I do have a PRN job at Primary Children, so I can speak to both Utah and to Phoenix too, or Arizona. I'm more heavily, obviously, involved in Arizona since it's my full-time job. Our governing board, I agree with all the licensing. I will say we don't have CMEs here. Utah does, but Arizona doesn't. So that's a bit of a difference. It's different state to state. I do agree with that. One thing that I definitely wish that Arizona would do, and we tried to do this several years ago, but our credentialing is done specifically by each hospital. So, for example, I work for Phoenix Children's now, but now we actually have contracts with 4 different hospitals. So I can go to all 4 of those hospitals, and we're about to take over at least one more in the next year or so. And so we're expanding, but every hospital requires their own credentialing. And even so, like Phoenix Children's, I work for them. So my credentials, that's a pretty easy process because I'm employed by them. Our other 3 hospitals right now are actually owned by the same company. So it's kind of like being Intermountain versus Mountain Star. I'm thinking Mountain Star somewhere up there too, right?
Mhm.
So 2 different companies. And even within those 3 hospitals, they are separated out into 2 entities. So I have to apply for credentials basically at 3 locations. And the paperwork is annoying, and you have to pay a fee at every place to get your credentials. I mean, Phoenix Children's covers it. It doesn't come out of my pocket, but still, all these different hospitals. I wish that Arizona had like a centralized credentialing center, because I feel like there's so many different hospitals and so much paperwork that's involved with it, that it's time consuming, and you have to do it every 2 years and update everything. And so I think that's frustrating, from that perspective, from credentialing. We were just talking about privileges the other day, actually, because this I find very interesting. And this is pretty much state or within the states, like Utah and Arizona, kind of the same, is that when you get credentialed for something, like let's just pick, I'm going to pick a procedure. So, like a chest tube, for example. So, because I've been out at a level 2 NICU in the last 2 years, I haven't had the opportunity to do a chest tube. And we don't do them a lot anymore anyway, but still. So, I haven't had it. So, now on my credentials, it's like, it's a supervised privilege. Now I have to be supervised by a neonatologist to actually do the privilege. So what's interesting to me is that, and I've been doing this, 18, 17, almost 18 years now, is that a physician can come right in and just get credentialed for those. They don't have to have supervision. They don't have to check off. They don't have to do anything to retain their privileges. But now, and I'm the one probably most likely doing the procedure anyway, not the physician. And so it's interesting to me that we have to be supervised by a physician for things that we do almost more than they do. So that's a frustration.
Yes. Yes, I can see that. Alrighty. Let's
Did that
see.
answer
Do you,
that question? Sorry.
yes. No, you're good. You're good. Do you consider yourself working in a collaborative practice? How often do you collaborate with other professionals? And can you think of a scenario where you saw clinical um, consult with another professional and it helped, and how it helped the patient's outcome?
Oh, Yes, for sure. This group that we have created, because we just created this group 3 years ago, so we came from a bunch of different groups to create the Phoenix Children's Medical Group. And I love the way our group works. We are seen very much almost equal to the physician. Like we are a provider, we are all providers. So if we need a shift covered, it doesn't matter whether it's a practitioner or a physician that picks it up. We cover and we cover each other. I mean, yes, at our level two, a physician has to be on call. Like there's rules, for that and everything, which are appropriate. But truthfully, we cover for each other all the time, and we're seen very collaboratively. Our neos pretty much, it takes that moment of like getting to know each other and trusting each other, but we practice very independently here. We check with the physicians if we need to. And then in our facilities, because we do deliveries, the important relationships that have kind of grown over the last few years are with our OBs and midwives, because now we go and speak with a parent before the baby's born with the OB, or we have a conversation directly with the OB to, be very collaborative to kind of put a united front up for these families so that, and it's one of the scariest things that they're going to have to go through probably. And so we try to prepare them the best we can and just show the families that we are on the same page with each other, I think is very valuable to the families.
I think it brings our stress down just a little bit to know what is to come.
Mm-hmm.
All right, just two more questions. If
Okay.
you could give, and it's outside of working as an NP, more on the private side, what one piece of advice would you give a new nurse practitioner? Something, even if it's to start a new hobby or if it's as becoming a new one, what advice would you give?
100% work-life balance. Make sure, I mean, when you're first learning and you're first graduating, yes, you need to be invested in working and getting to know people and getting your role down and things like that. But don't lose your outside life. Travel, our schedules are pretty good. So, for us, we work 24, so I only work a couple days a week. I travel anytime I can. But it is important to find something else so that that's just not your only identity.
That's awesome. Also, do you see a bigger need for those families? And I would say your patients too, but it's more the families on the behavioral health side getting more help, I guess, more mental
Yeah,
health. Is
100%. Our patients, they're going through, I mean, I get my patients are the little ones, but their parents, grandparents, aunts, uncles, that's a whole family didn't expect this, or maybe they do. Maybe this is something difficult they're going to go through. We actually do have a psychologist on staff at Phoenix Children's, and we didn't used to. And I think that that has been very, very beneficial. We have all the bereavement things, we have all of the support. We offer them therapy. And we even have like, uh, what is it called? Oh my gosh, I just blanked. But we help when the siblings, we actually have Child Life. That's what I was thinking of. Child Life come and talk to them, but we offer therapy to the entire family. So I think that psych is like, and I told you that was my second passion was psych when I was in school. I absolutely loved it. I find it fascinating, and I think especially as our world changes and things we've been through in the last few years, I think psychology support is so important. Doesn't help my babies much, but it helps their families be able to function better, and then they can focus on what is important for the baby too, instead of just being all scrambled.
yes. Well, thank you, Kim, so much for taking the time and talking to me.
You're welcome.
And
Thank you for
everybody
asking.
else that's going to be watching you in my
Oh
class.
gosh, that's scary.
Yeah, yeah, they'll love it. It'll definitely be something different than everything else that they see. So I appreciate it
Oh, no
so much.
problem at all. I'm glad I could help you.